all the health care that the system has in the system? Am I obligated to do that? See, this is a question we got to ask, because this is what it really comes down to, is that what is our obligation to the individual, and what is the individual's obligation to the rest of us? Are you following me? You see, if I was anywhere near Washington, the one thing that I would just introduce into the conversation is this whole idea of work, because I really think it comes down to who's willing to work. Who's willing to work? Paul says if a man doesn't work, neither is he entitled to eat. I didn't say that's what Paul said. Now, he's talking about able-bodied people now. We're not talking about somebody that's too old, somebody that's too young, someone that's mentally or physically capacitated, but he's talking about able-bodied people, because when you feed able-bodied people without them working, you have removed the incentive for them to work. See, hunger pains is an incentive for people to work. The discomfort of being hungry. Listen to me, listen to what I'm trying to tell you. So when you take that incentive away, people are not motivated to work. What we've got to do is we got to get more people motivated to work. And if we start talking about everybody that's too old to work, we're going to take care of them. Everybody that's too young to work, we're going to take care of them. But those people that's not too old and not too young, and those people who are not mentally or physically incapacitated, then they have to work. And then we're going to tie benefits to a person's willingness to work. If we do that, you'll change the paradigm and you'll change the equation. This sounds hard, ladies and gentlemen. Let me tell you something. I will give you the report. In West Virginia has the lowest workforce participation rate in the country. What does that mean? Not unemployment, workforce participation. There are 1.83 million people in West Virginia. Of the 1.83 million, less than 800,000 are working. So it means that less than 800,000 are working. That means that 1 million plus are not working. And some of them are too old, and some of them are too young, and some of them are not mentally or physically capable. But the problem is we have the lowest workforce participation rate in the country. The lowest in the country. Only 56% of the people who are of working age are working. Now, this is a recipe for economic disaster. If we keep on doling out benefits to people who are not willing to work, they're not paying taxes, therefore you don't replenish the treasury, so you can't keep doling out benefits unless you keep raising the taxes of those people that are working. See, giving everybody everything they want sounds like a good idea. The only problem with that is what my mom used to say: if you're going to give a dance, you got to pay the fiddler. Somebody got to pay. And there's not an endless resources to pay everything that we want to give people just because they want it, in some cases because they need it. Now, I'm a compassionate person. I'm trying to work my way through this. I'm trying to work my way through what is our obligation to the individual, what is the individual's obligation to the rest of the society in terms of what their responsibility is, you see. We need to weigh into this, and you need to think about it, you need to listen to it, and you need to pray about it, because we're getting ready to have something we're going to do. And we're going to live with it, and we're going to have to pay for it. We just want to be as right as it can possibly be. And I don't know what the right answer is, but I'm convinced the fellows in Washington don't know either. But I do know that whatever it is, we're going to pay for it, those of us who work. And we're going to have to be dealing with it for a long time, and our children and our grandchildren are going to pay for it. And what I'm saying is that we as Christian people, we should be advocating work. We should be talking to our legislators, but we want a work program. We want people working. Able-bodied people need to be working. Because if they're not working, they're going to probably get involved in something that is destructive, something that is unhealthy for them and for us. And if a person is working, then we want them to keep working, and we want them to be healthy so they can keep working. Therefore, we will make sure they have access to health care and whatever. I'm not professing to be an expert on this, but I am a citizen. And I'm trying to think this thing through to figure out where is our responsibility? What is our responsibility to each other? What's our responsibility as a society to each other? And what's the individual's responsibility back to us in a free society? This social contract that we're supposed to have. And it's not supposed to be a one-way social contract. It has to be a social contract that's both ways. We as a compassionate society want to help the least, the last, the left out, the left behind, the too old to work, the too young to work, the physically and mentally incapacitated to work. Yes. Then what's their responsibility back to us? And then what's the responsibility of other individuals? If we don't start talking in these type of terms, then a state like West Virginia, it won't take us long. It won't take us long to be bankrupt. I mean, in a hurry, in a real hurry. And so teaching our kids to work hard, and pressing it upon them from the earliest possible age is a tremendous contribution that we can make. It's a tremendous contribution we can make to our city, our county, our state, and to our nation. What we believe really does matter.